Hi, everyone. Things are actually relatively stable for us with respect to COVID as well as hepatitis A. So there's not a lot to report today. Our COVID numbers do seem to be going down a little bit. I'm cautiously optimistic, but we all know that with COVID, we just don't know. But if we look at our hospitalizations and our weekly case counts, they're a little bit down compared to the last couple of weeks. So again, cautiously optimistic that perhaps we have peaked, but it's very, very challenging with COVID to know our future. With respect to hepatitis A, we have actually only had one more case in the last 2 weeks, so that's great news, and hopefully that means that between the vaccination efforts and all of the prevention messaging, that hopefully we're seeing the tail end of our hepatitis A outbreak. So that's all really good news for us. With respect to monkeypox, Virginia Department of Health continues to report monkeypox at the regional level. And so I'm sure you can see that our region is at about 8 cases, or is at 8 cases. In Virginia, we've had over 200 cases. And across the country, we're at about 12,000, just under 12,000 cases. So really, it's a brief report today that from a hepatitis A standpoint and from a COVID activity standpoint, things are relatively stable. And we are cautiously optimistic that things are improving slightly on both of those fronts. And so with that, I will open it up to any questions that you may have.
Dr. Morrow, this is Tom Burke, WFXR. How are we looking for flu cases this year? Have we seen any early indications of flu, and do we know when the vaccine will be available?
Well, that's a great question, and one of the challenges is with this past flu season is that typically we stop seeing cases. So, depending on any given year, we may see peaks of our influenza activity in February, March, and typically we stop seeing cases of influenza by April, May. But influenza activity has continued to percolate throughout the year. So we don't have that same clean sort of break where we have a few months in the summer without any cases before we start seeing new cases, if that makes sense, for the next flu season. We typically look at our flu seasons as starting in September and October. But we've continued to have influenza cases, specifically influenza A cases throughout the summer. So when I say we, at the state level, we don't track influenza A. It's not a reportable disease. So we don't really track that activity level. But if we look at surveillance, we can see that it's sort of been percolating. So I can't tell you whether this is the beginning of the 2022-23 season or whether it's the end of the 2021-22 season. Does that make sense, that we're in an unusual situation with respect to flu activity?
Yes. Do we have any idea of when we'll see new flu shots?
That's going to be really dependent on the healthcare provider. I don't know whether people have started to receive their flu vaccine orders, but it's not at all uncommon for people to start getting their flu vaccine orders in August. We recommend in general that September, October is the peak time to get your flu shot, maybe even October, maybe even later. The bottom line for flu is ask your provider whether they have their flu shots. Because there is some flu activity going on, it's not a bad idea to get your seasonal flu up to date now, but typically we recommend September, October. And that's people should just ask their providers whether they've gotten their flu vaccine orders in yet.
Thank you.
Sure.
Dr. Morrow, this is Dave Seidel from Radio IQ. I'm just curious, with the recent changes in guidelines from the State Department of Education and the CDC in the last couple of weeks, what's the best advice for students and parents regarding COVID and going back to school as schools start up?
Well, certainly the most important thing for us is for those who want to be optimally protected to continue to make sure that they're up to date on their vaccines or their COVID vaccines. So if I were the parent of a school-aged child, I would certainly want all of my children to be up to date on their COVID shots, as well as all of their regular back to school vaccines. So vaccination continues to be the best tool that we have, albeit an imperfect tool. The reality is that the COVID-19 situation that we're seeing today is very different from the COVID-19 situation that we saw in 2020 and 2021. The circulating strains, B4, B5, primarily B5, are less virulent. You know, we're seeing reports that the most common symptom is now a sore throat rather than shortness of breath, and it has to do with where this particular subvariant, what cells it invades. So the mucosal cells versus the lung cells. It's complicated, but the bottom line is B5 appears to be less virulent. So we have a contagious but less virulent circulating strain. We have vaccinations available to anybody who wants to get vaccinated. We have a new vaccine available for people who might have been reluctant to get an mRNA or an adenovirus. There's the more traditional COVID-19 vaccine available now. And we have more therapeutics available. So if someone is at high risk and gets COVID, there are more options for treatment. And so with that combination of pretty significant differences of where we are today compared to where we were a year ago, and certainly where we were 2 years ago, the guidance has changed. And I think that it's really up to families to determine what their risk tolerance is. It's important to realize that our jurisdictions are still in high transmission. Even though I just said our numbers are going down a little bit, it's not a trend yet. It's 1 week of our numbers going down. We are in high, our communities are primarily in high transmission communities. So I would certainly recommend, if this were my family, that my children wear masks. But we know that it is certainly not a requirement. It is a recommendation based on our community transmission, and ultimately is up to the families to determine their level of risk. So bottom line, up to date on your vaccines, talk to your family about what their risk tolerance is. While we're in high transmission, I would certainly encourage masks, but I know that that's not consistent with what a lot of people want to do. So it's really up to their choice.
Thanks.
Sure.
Dr. Morrow, Isabella Ladon with WDBJ7 here. Thanks so much for joining us this morning. Can you speak a little bit more about the monkeypox vaccine and what our folks in our Roanoke area should know about it if they want to get it?
Well, the most important thing about the monkeypox vaccine is that it is restricted to those who are eligible to receive it right now. And so it's important for us to look at who is getting this virus, this orthopox virus. The people who are getting this orthopox virus are almost exclusively individuals who engage in risky behavior, risky sexual behavior. Now, of course, there is some transmission in households, but that's very limited. Overwhelmingly, what we're seeing this is in individuals who have intimate, prolonged skin-to-skin contact with someone who is infected. And so it's not a vaccine that is available, nor does it need to be available to the general public. It's really a vaccine that we're targeting to those who are at highest risk of contracting this orthopox virus. So those individuals who are eligible, and I know, Christy, you put that in the link in the chat last time, if we could do that again. Individuals, so men who have sex with men, individuals regardless of their sexual orientation or gender who engage in high-risk behavior such as multiple sex partners or anonymous sex, anyone who is a sex worker, anyone who works in an area where sexual activity is likely to occur. So while it is not a sexually transmitted disease, it is transmitted through intimate contact, primarily skin-to-skin contact of those individuals who have the infection. So it's important for anybody who's in that risk group to call us, and if they're interested in getting vaccinated and protecting themselves against this, to call us, and we can certainly schedule them to get vaccinated.
Got it. And now that the federal government has declared monkeypox as a federal emergency, how does that change our vaccine supply here in Roanoke? And does that give us any more funding to be able to distribute that vaccine to our community?
We don't have specific funding for monkeypox at this time, we, the Roanoke City Alleghany Health District, doesn't have specific funding earmarked for monkeypox response efforts. But at this point, we're not seeing a need for additional funds. What the declaration provides is more flexibility in the allocation of existing funds. So if we need to have some of our individuals who do contact tracing, case investigations and contact tracing, who are currently funded under COVID funds, we do have the ability to have them do some monkeypox investigations should we need to do that. At this point, our capacity has not been compromised. We have not felt like we needed additional resources, but that declaration provides us with more flexibility to use resources in a less restricted way. So at this point, I want to stress again that while Southwest Virginia has seen cases, we're not seeing a huge burden of disease at this time. We're really hopeful that with vaccination efforts and with all of the education that we're doing about how monkeypox is transmitted, that we can curb any further cases. We certainly have the tools to be able to prevent further cases. We just need folks to take advantage of those tools.
Dr. Morrow, thank you.
Absolutely.
Hi, this is Henry Gendreau with the Roanoke Rambler news site. I'm wondering, Carillion recently said it is postponing plans to build a new mental health facility in Roanoke as part of its planned expansion. I was wondering, curious if you'd heard of that and what your thoughts are, or if you have a response to that development.
I actually have not heard of that. I'm really, we're very fortunate in our community that we have really strong relationships between our community-based organizations such as Bradley Free Clinic, which just opened up their mental health wing, and with all of our healthcare organizations. So I'm not aware of that information, but I'm confident that we have the partnerships in place to address the needs that we need to. And thank you for sharing that. I'll contact my colleagues and see if there's anything that we can do. At this point, I think that we know in general that across the country, and this is not specific to the Roanoke City Alleghany Health Districts, but that we have an unmet need, and that's with respect to mental health services, and that is happening across the country. And so it is our job in public health to try to help our partners identify what we do in needs assessment, identify both needs and solutions. And I know that we're really lucky here with Healthy Roanoke Valley, with Carillion Clinic, with Bradley Free Clinic, with Lewis Gale, and with New Horizons. These are just a few of our partners. And of course, Blue Ridge Behavioral Services that we will partner. If there is a gap, we will partner to address that gap to the best of our ability. But thank you for bringing that up, and I will try to get some more information about the potential impact on our community.
Thank you.
Not seeing anything in the chat. Any other questions?
Dr. Morrow, I just had a quick follow-up question, just because I was didn't quite get it on recording. How would you describe the monkeypox situation in our community right now? I know you explained that at the beginning, but can you speak a little bit more about that?
Sure. Well, I think it's always important when there's a new virus, and certainly this orthopox virus, this monkeypox virus, is a new threat. It was just declared a public health emergency in this country. But I think it's also important to contextualize it. So if we look at the entire Southwest region, 8 cases, across the state, overwhelmingly, we're seeing the monkeypox cases in a specific demographic. Men are disproportionately impacted by this. So this is not, yes, we need to do everything we can to ensure that those who are at risk have access to vaccine and have access to good information on how to prevent the transmission of disease. But this is not a disease that at this time is a concern for the general public. It is really a disease that is confined to individuals who are having very intimate, close skin-to-skin contact with individuals who have monkeypox. So we know we have the tools to prevent further transmission, and our job in public health is to make sure that we're making those tools accessible to all of those who need it.
Thank you very much.
Absolutely.
All right, well, thank you everyone very much for joining us. I will get the data out to you shortly, and if you have any follow-up questions, as always, you can circle back to us. Have a great day. Thank you.
Thank you.